Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at the biomedical approach to health in Unit 3, Area Study 2, VCE HHD. Before we dive into this video, just a reminder there's a range of different ways you can engage with the Health Resources Hub. We've got our YouTube channel where there's over 150 content videos, SAC and exam tips, and new videos are coming out each week during the school term this year. If you're on YouTube, you can subscribe with the button in the bottom corner of the video there, or you can just search for the Health Resources Hub on YouTube. We've also got our website, the hrh.net.au, where there's opportunities for teachers and students. If you're a student, you can head there and scroll to the bottom of the page and you'll see there's a link there to register for our free student newsletter. That's coming out twice a term this year with free SAC and exam resources, and if you sign up you'll get sent the first 2 versions that have already come out this year. We've also got our social media links there if you'd like to follow us and get alerts to new videos and other opportunities, and also our email if you'd like to get in touch. Okay, so the biomedical approach to health is looking at how this particular approach has contributed to improvements in Australia's health status since 1900. And so this approach has existed since 1900 and still exists today. And it has a focus, you can see there, on diagnosis, treatment and cure. So it's really focusing on health professionals and how an individual will come to a health professional typically and say, these are my symptoms, can you help me work out what's going on? They'll perhaps use some kind of technology or their experience to make a diagnosis and then make a plan to hopefully treat and cure that person's condition. So you can see that the second point is it's returning people to their pre-illness state, hopefully, and it's utilizing health professionals and medical technology. So examples of this approach include things like X-rays, obviously you can use those to diagnose things like broken bones and tumors, antibiotics for things like bacterial infections, surgery, blood tests for a range of different diagnosis of conditions, and also medication such as blood pressure lowering medication. And there's a range of different, obviously, other examples that are related to diagnosis and treatment. So it's good to know, okay, some examples, because you might be asked to outline how the biomedical approach may have contributed to improvements in Australia's health status. And so using a specific example as part of that would always be quite useful. There are some advantages and disadvantages for this particular approach. So you can see there in terms of the advantages, it can help to extend the life expectancy of people in a population. So if an individual does attend, a healthcare facility or see somebody like a doctor and they're able to get their condition diagnosed and treated, they're less likely to die prematurely, hopefully, and that therefore can extend life expectancy. The second point there, it can help to improve the quality of life for people if their illnesses can be treated and cured. That's relatively self-explanatory. And then the third one there, it can lead to advances in medical technology. And that's because there's often obviously people around the world that are trying to come up with new ways to diagnose and treat a range of conditions. And so this approach here obviously contributes to those advances. And you'll also look at some examples of advances or changes in medical technology over the last 100 or so years that have improved, Australia's health status. In terms of disadvantages, you can see that it can be expensive or costly as it relies on medical technology and health professionals. If you are asked for a disadvantage, try not just to say it's costly, try to give some additional information such as it relies on those medical technology and health professionals, just to make sure that you're giving enough detail in your answer. The second disadvantage there, not all conditions can be treated, so this approach may not necessarily always be useful. For some conditions, it's better to prevent them than try to diagnose and treat them, so that's a disadvantage. And also, it doesn't necessarily promote healthy behaviours and lifestyles. If people think that they can engage in activities, say, such as smoking or an unhealthy diet, and then they can just get some treatment if they become unwell, then it's not necessarily something that's promoting healthy behaviours if people feel like health conditions can just be treated. So I would just know a range of advantages and disadvantages of this approach. Here's an example of a question, that has been asked in a previous exam to give you a sense of how you might be asked to apply your understanding of this approach. So you can see there they got students to choose either tuberculosis or malaria, and then they were asked to explain how the biomedical and the social models of health, which we'll look at in a future video, may have led to a reduction in the percentage of total deaths caused by the selected disease between 1990 and 2017. And so I say to my students, you don't have to be an expert on these conditions and know exactly the type of treatment that is required to reduce deaths, but you need to understand that the biomedical model involves things like medications, surgery. And so you can see there the example of the high scoring response. says that this model may have helped to reduce deaths in malaria, as they may have been able to create medications and treatments that have been able to cure malaria and reduce its impact, making it easier to survive. And so you can see the student has just taken their understanding of the biomedical model involving things like medications and then applied that to the condition of malaria. They're not focusing on a specific type of medication, okay, that they know treats malaria. You're not expected to know in that much detail, but you are expected to be able to apply your understanding, okay, to a question like that. Okay, hopefully you found that video useful. Just a reminder, we've got a Unit 3 Error Study 2 SAC preparation session, or 2 sessions actually, coming up on April 14th and 28th. So you can head to our website or that link down the bottom there to register, and you'll get a 50-mark practice SAC emailed to you the day that you register. And then we'll go through that during the session. I'll go through a mark-by-mark breakdown of the answers, and you'll also get a copy of the answer guide following the session. So please consider signing up. Thanks so much.